Well, hello again, everybody. Welcome back into our Keep Boone Healthy Community Information Channel. I'm David Jackson, President and CEO of the Boone Area Chamber of Commerce. And as we told you yesterday, we were going back to back here with some important community news. Yesterday, we talked with Watauga County School Superintendent Dr. Scott Elliott about some of that new North Carolina DHHS policy. And there has been even more news coming out of the state as it relates to COVID. Today, we will talk about that with our featured guest a little bit later. But Chuck Mantooth joins us from Appalachian Regional Healthcare System, where he is the president and CEO. And on Wednesday of this week, ARHS made an announcement about seeking some partnerships that may enhance the hospital system's ability to do more efficient work and provide a better care overall. As it relates to the business operation that runs such a facility in our community. So, Chuck, thank you for joining us and wanting to just kind of give you an opportunity to explain exactly what that relationship is that you seek at this point in time and how will that overall benefit the hospital system.
Yeah, great, David. Thanks. Glad to be back. And for some reason, I always seem to follow Scott Elliott. That's a hard task. I'm not sure why you keep.
It's alphabetical.
Okay. Well, Scott's smarter and more articulate than me. So I'm sure I'll try to fill in the gaps here, do my best to follow him. But no, seriously, thank you for the time. First of all, appreciate what you do, your leadership, and bringing information to the broader community, and then more specifically the business community. But yeah, we had a great announcement, came out Tuesday. That's been in the works for a little while. And actually, it's a really good story. And maybe that's probably the best way to get started and fill in a little bit more color to the press release that we put out and information that's on our website. But our board started strategic planning about 9 months ago. And as part of that, we were due to really create a new vision and really direction for our healthcare system. We even though we were right in the middle of that pandemic, the board says, look, this thing is going to slow down at some point and even come to an end. What are we going to look like after that? And there's no better time to do it when the healthcare environment has been disrupted like it has over the past 2 years. So the board, in its wisdom, took that process on and was really diligent about, a strategic planning process. And as part of that, they identified a pretty bold vision for our healthcare system and how that relates to our community. And part of that, there's two basic components. One is to broaden what we're doing in our primary care base. We just feel like that, to be an effective healthcare system, let's try to create a healthier community. And the way to do that is to really kind of create a more robust interaction, especially around primary care with our healthcare system. Second part of that is continue the path that we've been on for years, is to offer services here in this community that, people would traditionally have gone to other larger communities to receive. So that vision has really been focused around that two area. And then also the board started looking as part of that process, what are maybe some of the things that we can do on our own? What are the things that maybe we could form a relationship with another healthcare system that could accelerate some of those things that we define in our vision? So as part of that process, we went through a structured conversation with other healthcare systems, and we felt like that we were far enough along to really come out with the information that we had regarding, I guess, a little bit more detail and information that was relevant to the community. So we did that on Tuesday. Wanted to make sure that we communicated a few of the things that we are not going to do. Let me also start with, we are in a position of strength financially and clinical quality. So from that position of strength, what we were able to do was define kind of a narrow criteria of what we would accept and what we wouldn't accept as far as a relationship with the healthcare system. And part of that criteria came out in that press release that talked about, we're seeking a potential relationship with a like-minded, not-for-profit healthcare system. And what that means is that we've worked hard to create, a culture that's, I think, friendly to physicians, that realizes the value in our employees and also value in investing in good facilities and good systems. And not-for-profit status was important to us too. We've looked around at other situations in our state that have been similar to that. Some have gone to a for-profit model. The board just says that just doesn't work for our community. We're not going to entertain a sale. It's not, ARHS is not for sale. We're not going to merge. We're not going to be acquired. Whatever we do moving forward, if we did decide to take a relationship to the next step, we will want to maintain local governance and local leadership. So those were our narrow criteria that we developed based on the position that we felt like they were in. But we felt like the time was appropriate to look for another healthcare system to help us maybe accelerate, our progression towards that new vision.
So along those lines, Chuck, you mentioned that those parameters are so narrow. What are you hoping that a system can come in and help you deliver? When you talk about being in a position of strength, both clinically, which is incredibly important, financially, which is just as important, but also with a brand here that resonates as well as yours does. What can this assistance help you achieve in terms of growth and some of that strategy that you're talking about with your board?
Yeah, one of the key opportunities I think that we found for that could accelerate some of our results, as I mentioned earlier, was around our IT platform. Now that in healthcare, that has slowly become a crucial tool and investment, a very expensive investment to basically create good communication with patients, good workflows within our healthcare system. That billing process, which is very complicated. People don't understand that. How can we make that a little bit more palatable and transparent with folks? And that investment is very, very expensive. So our providers and our community are asking for something different. And that's where we feel like that is kind of leading the tip of the spear in this process, that we looked at our current systems and we felt like to be this healthcare system that we want to be for the future, or this vision that we've created, we really need to look towards another system. And that's really kind of the biggest gain I think we would receive by working with another healthcare system.
So I think some people can take this from the business sense and just understand that sometimes you can get more bang for your buck in bulk than you can as a standalone entity, maybe trying to achieve something, whether that is some sort of office efficiency or operational efficiency, or maybe some other metric that those of us in the business community may be looking at. Is that kind of similar to what you're looking at here, that partnering with an agency might be able to bring some operational efficiencies and opportunities that, based on your size and based on your makeup, you might not be able to receive otherwise, or at a price point that is as palatable as it could be with a partner?
Yeah, it's all about scale, and that's kind of where I go. And when we talk about bigger, we're a $250 million organization. We're the second largest employer in the region. Appalachian State's obviously number one there, but even though we're a relatively large organization in our region, comparatively, we are, on the smaller range especially for independent healthcare systems. And you're getting up into the multi-billion-dollar range. And when the board looked at that, they said, look, that's the kind of scale really it's going to take to really get this leverage that we need, especially on buying equipment and supplies and things like that. It really got accentuated around the pandemic, when you're talking about trying to get masks at an inflated level to be able to buy these in bulk and scale. That just translate into better performance financially for our healthcare system. So that's obviously one. The second is really kind of back to IT. The IT platform that we've set a high standard to try to achieve. We want it to be world-class and state of the art. And that's what we can achieve by working with another healthcare system potentially that we really just can't get to on our own.
So, Chuck, what are the next steps with this now? You've talked about going through the process and kind of stating your intentions, if you will. What kind of feedback have you received thus far, and what will this mean for the overall operation of Appalachian Regional Healthcare System as we move forward here throughout 2022?
Yeah, we what we were trying to avoid is gaps of information. Now, what we announced, we announced we're in the middle of this process. We didn't announce who. We have not selected a person. We don't even have to move forward. but we felt like the timing was appropriate to at least get that information out there. The danger in that sometimes is to only tell half the story and then not fill in the rest. And what we're trying to prevent is people filling in that story on their own. And that's why we're trying to be as transparent as we can. And I appreciate your help in that. We've had multiple town halls. I had an email today from a department leader that was 10 questions deep about questions they had received. So we're trying to just go through the process of being transparent as we can and then stop short of speculation. So, sometimes that balance is really, really tough. But what we can expect moving forward is, the board fully understands that a hasty decision is not good, but then also announcing this and then a big long delay in between when we may come back out and say, look, we feel like we're going to do this on our own, or yes, we've selected a key relationship we want to follow through with. That timeline is really sensitive sometimes if that goes on too long. So the board's really keyed into that, and that's what we can expect really probably over the next couple months.
And I think you've addressed this, and maybe an opportunity for you to address it again, because I think the key things that come out of conversations like this are, some people understand the back of house operations and can understand why you make the move in that direction. They're going to want to know, is my doctor changing? Is my relationship with my healthcare provider changing? And is there any way that you foresee that this kind of relationship would impact any of that kind of stuff? And again, I think you've addressed this, but saying it again is never bad.
I don't. I think if you have a doctor today and changing a relationship that we may have, that's not going to impact the doctor. What I would foresee are all positives, because where we started, we've got this narrow criteria. We feel like that, if we find the right partner with that narrow criteria, it really is just going to propel us. And the impact of the community is they're going to be the big winners in this. If we can find like-minded culture, build better systems, brand new facilities coming online, the community is going to be the big winner in this. So I can't wait till we can come out and finally, get to the point where we're talking about exactly what it's going to look like. So then those fears are maybe alleviated a little bit more.
Well, we certainly appreciate the extra insight on this and look forward to that announcement, and we'll continue to keep people abreast of that. I've got two final questions for you before we let you go. One of them you just alluded to a moment ago about a brand new facility opening up. Every time you drive around the area of Deerfield Road, you see something new on the outside of what will soon be your new bed tower. Can you give us an update or any kind of anecdotes about what's going on the inside of all of that construction now that we can't see it anymore?
I can, and Rob Hudspeth may kill me, but I'm not going to go. I'll tell you that we are really ahead of schedule, and I'll tell you why. If you'll allow me just a second, when we started the planning process, kind of like what we're talking about here with our strategic plan, with looking for a relationship similar to that, was really extensive planning on our facilities within our healthcare system and what needed to be replaced. The pandemic hit in the middle of that. The board never paused. They never stopped. They kept going. So what that allowed us to do was to get in the front of the line as far as contractors, subcontractors, and then also obtaining materials at a lower price. And because of that, that put us really ahead of schedule. I'm hesitant to say how far ahead of schedule we are, but we are really ahead of schedule. And that's going to benefit the community because that just means they'll have access to these services quicker. It's going to benefit our employees. They'll have access to technology that they don't have today. And it really is going to be a win. So we are months ahead of schedule. And I do anticipate, being in that building before the end of this year.
Okay, so I lied. I have another question that comes up from that response a little bit. And let's go back to what we were initially here to talk about. Does that in a way make your system more attractive to a potential partner? Because not only with the bed tower, but other changes that you have made about what you offer, where you offer it, does that make you more of a desirable partner for somebody that can then bring you some of those efficiencies based on some of this new investment that you're putting into your facilities?
Yeah, David, too often these calls are made to larger systems because they need to be bailed out or they have a negative outlook. We've got a really bright outlook. New facilities, a great reputation in the community, great doctors, great clinical quality, puts us at a position to where we can be choosy. And I will tell you that, as we've made these calls under a confidential process, the dialogues we've had, it's been very favorable. There's a lot of interest. And so that was affirming. We don't want to get over our heels with, and love ourselves too much, but we've got a great reputation. We're pretty proud of what we've built. So that's put us in a good position to be selective.
Final question for you then centers around the topic of the day today. And as we record this, we are just about an hour removed from Governor Roy Cooper making a statement here just a while ago about his desires to see mask mandates begin to be lifted by municipalities, by local school systems, and having some pep to that action, not necessarily letting that go on for a while. You obviously are at ground zero, and Appalachian Regional Healthcare System has been very public here lately about how your system has been taxed through this process. How do you see this conversation evolving from your perspective? Continuing to see patients? Are you seeing that start to trickle back down again, or are you still looking at a pretty sizable impact on your system today as we speak? And I'll put the date on this on February 17th.
Yeah, let me start with our current situation. We are definitely on a downward trend in regards to hospitalizations. It is still a large percentage of our inpatients. What I think this morning is around 30%. So that still creates the same stress on our staff, supplies, all these things that we've dealt with for 2 years. So I'm trying to balance that with we know people are tired of wearing masks. People are talking about it. So I think that just the population, we're just weary, and our healthcare providers are in the same boat. The hard message is this thing is not over. We're on a downward trend. Downward trend does not mean we've landed yet. It's just a bumpy ride on the way down. It's an uneven ride down too. What one community experiences may not be what we're experiencing here. So, it is a little bit of a challenge with a blanket statement. And I think the way I understand the announcement to be is that now it kind of goes back to you decide on the local level what you'll accept and what you're not. And I look forward to any opportunity to kind of give some advice on the local level from at least my perspective. I know there's lots of politics involved. Again, I'm just as tired of wearing this thing as everybody else, but this thing is not over. So just wanted to provide that public message.
I'm about to say there is no shortage of politics or opinions about this particular topic, but certainly we respect what you and your staff and truly appreciate what your team has been doing for the last 2 years to go to work with that weight daily. I know it's a stress, it's a grind, and people are seeing it around a number of professions, but certainly our local healthcare providers have helped keep this community as healthy as it has been. And hopefully will continue to be. And so please, on behalf of our entire community, let your team know that we're with them every step of the way and hope that their days get shorter here soon as it relates to COVID. So we do appreciate your time and your transparency. Look forward to talking to you again more about this and other things. And we look forward to cutting a ribbon on that bed tower here. It sounds like sooner than we may have thought.
It won't be cold by the time we cut the ribbon. So that I'm trying to. Rob's gonna really get mad at me, David, if I keep going where I'm going. So
I keep trying to get you to say more things to enlight his fire a little bit more, but we'll see what happens. So, yeah. Chuck, thank you very much for your time, and we look forward to visiting with you again soon.
Thanks, David. I appreciate what you do.